And welcome back to the Showroom Presents. You know, anybody who's ever drank a glass of milk probably knows it's a good source of calcium, and calcium, properly regulated in the body, is essential to good health. However, there's a rare medical condition called hypoparathyroidism where people cannot regulate the proper amounts of calcium in their blood. And the symptoms of this condition can be really difficult, sometimes as many as 16 different symptoms a day, and none of them are good. Here to talk about a recent study on this condition are a patient, CeCe Donoghue, and physician, Dr. Michael Levine. CeCe, Dr. Levine, welcome to the Showroom Presents.
Thanks for having us.
Thanks for having us.
Dr. Levine, what does this recent study show?
Well, this recent study really is, in many respects, a landmark study because it focuses on all the symptoms that patients with hypoparathyroidism experience. And as you've already mentioned, the parathyroid glands are critically important for regulating the serum level of calcium. And when these glands are not working properly or they're absent, then blood calcium levels are too low. And we used to think that this caused principally some tingling in the fingertips, around the face and mouth, and perhaps in the feet as well, and some muscle cramps. But what this important new study does is extend the diversity of symptoms that patients with hypoparathyroidism have. And in addition to the symptoms we've already talked about, they also have problems breathing sometimes, GI problems, and something called the brain fog that CeCe can talk about because she's experienced this. This is an important study because for years patients would come to our offices and complain about some of these symptoms, and we really didn't quite understand the relationship of these symptoms to hypoparathyroidism. And now this study enables us to focus clearly on blood calcium levels and hypoparathyroidism as a cause of reduced effectiveness in the workplace, reduced productivity in overall life, and for some patients an inability to function in the world, having to retire, for example, because of uncontrolled hypocalcemia.
Now, CeCe, you're a wife and a mother of 5, and I understand you had a thyroidectomy. And tell me a little bit about your story and how what kind of symptoms have you experienced, and what's it like?
Well, over the past 10 years, I had my thyroidectomy in March of 2005, and over the past 10 years, I've experienced just about all of the symptoms that Dr. Levine told you about. You know, every day I wake up symptomatic, so I can experience the very benign tingling and numbness in my hands and my feet and my face. And if I cannot maintain my serum calcium level, which happens, it can happen extremely unexpectedly that it drops, I can go into the more severe symptoms of severe muscle cramping and bone pain. I go into tetany where my hands sort of clench and they won't open, my jaw clenches. I can have laryngospasms and I can't swallow pills. And the symptom that frustrates me the most, as Dr. Levine said, is the brain fog. It's a very difficult symptom. My cognitive ability is very compromised, and really I can't function through a day when I'm like that.
Wow, and I mean, and these symptoms last, I mean, pretty much all day long, don't they? How do you cope with it?
For days and days. I mean, they can sometimes last weeks until you get your serum calcium level up, which is hard because I can't absorb it. So I cope with it by taking lots of medicine. I'm on a very regimented schedule. I take upwards of 14 to 19 to 25 pills a day, depending upon that day and my symptoms. I cope with it by staying well informed about my disease and seeking out all the information I can about it. I've become active with the Hypoparathyroidism Association, which has been a godsend for me. It's through them I've met other hypopara patients. I hadn't met another person with this disease for 7 years. And then finally I've connected myself with others with it, which has been a huge help. And of course I cope with it through my lovely family. I've got 5 amazing children and a wonderful husband.
Oh, that's awesome. That's fantastic. Well, doctor, I know CeCe's not alone. About what, 50,000 people are affected by hypoparathyroidism. And I know, a lot of people, I guess, have taken, megadoses of calcium and vitamin C, but there's some long-term health risks associated with that. So how would you suggest people cope with their conditions?
Well, as you said, about 50 or 60,000 people in the U.S. with hypoparathyroidism, and the conventional treatment with activated forms of vitamin D and calcium do increase the risk of kidney stones. And that's a very important side effect. And so when patients are being monitored, not only do we check their blood calcium level to make sure it's in the target zone, but we also look at urinary calcium in order to avoid overtreating the patient, leading to the risk of kidney stones. So that's an important point, that treatment sometimes, in order to maintain a normal serum calcium, can lead to a high urinary calcium, and that increases the risk of kidney stones.
Right. Okay. Very interesting. Now, CeCe, you mentioned there's some associations out there that you've gotten involved with and groups. Where can people go to find, like you have, ways to get more information, ways to connect with other people that are going through the same conditions that you've gone through? Where do they go to get this kind of information? Our viewers would love to know.
I would suggest that they immediately go to hypoparathyroidism.com, that website, and through that website there will be links to a lot of other advocacy websites for patients. That would be my first move. I wish they had had that 10 years ago. I really suffered silently and alone for about 7 years. So I would suggest that they go to hypoparathyroidism.com.
All right, thank you. And doctor, anywhere else besides that too?
No, I think that's a great resource. It's a great clearinghouse for information. And I would remind your viewers, if they begin to experience any of the symptoms we've talked about, they can get a simple blood calcium check, and that's a great way to learn whether or not you have hypoparathyroidism.
All right, so folks, don't shy away from your doctors. That's the bottom line.
Absolutely.
Okay, well, CeCe and Doctor, thank you so much for joining us today on the Showroom Presents, and I wish you both all the best.
Thank you very much.
Don, you call that showing off?
How about the dazzling diamond deals we're showing off at the Showroom on Union? Diamond engagement rings.
Diamond band.
Diamond anniversary.
Diamond fashion.
Diamonds, diamonds, and more diamonds.
All at a fraction of the pricey stores.
And buy with confidence, because all Showroom diamonds will come with a Gem Lab certificate as requested, guaranteeing natural diamonds of value. Don't forget, we feature GIA certified diamonds.
Showing off great diamonds and great deals every day.
At Airport Plaza Jewelers, the Showroom on Union.